Hello friends, welcome to all in today's lecture on the topic Physioclinical Significance of Dhatumal, lecture part 2. On this topic we have in lecture part 1 a detailed discussion about what is tissue metabolism, what is Dhatumal, that is the waste products of tissue metabolism, and how they are formed during the tissue metabolism and what are their clinical and physiological significance. So in the previous lecture I have discussed in detail about the mal of rasa dhatu, that is kapha dosh, and that means the malarupi kapha dosh and lasika. So during the tissue metabolism, that is the dhatu pak, the 7 tissues, that is rasa rakta mans med asti majja shukra, when they are acted upon by their respective dhatu agni, that is rasa agni, rakta agni, mans agni, med agni, asti agni, majja agni and shukra agni, then the dhatu, they get divided into 2 parts, that is sara bhag or nutrient part or the waste part. In the same manner as during the process of, after the completion of process of digestion by the action of Pachak Agni, the ingested ahar, it gets divided into Sara Bhag and Pitta Bhag, that is nutrient part and waste part, and from the Pitta part, all the mal, either it is generated at the level of GIT, that is Mutra and Purish, that is urine and feces, or at the mal which is generated at the level of tissue metabolism, that is Dhatu Bhag, by the action of Dhatu Agni, all are replenished by the Pitta part of Ahar Ras. So ultimately all the mal, they depend on the Ahar Ras. So in today's lecture I will discuss from the mal of Rakta Dhatu, that is Malarupi Pitta Dosh, whereas Acharya Sharangadhar has considered Ranjak Pitta specifically as a mal of Rakta Dhatu, which is more scientific. So I will start my discussion with the Malarupi Pitta, that is Ranjak Pitta. So in the previous lecture under the discussion of Malarupi Kaf, which is produced at the level of rasa dhatu transformation or metabolism, we have discussed that Acharya Vagbhat has described 2 kinds of dosh, that is prakrit and vakrit dosh. Dvividha vatadaya prakrita vakritash. The prakrit dosh tatra prakrita sapta vidhaya prakrita heturubhuta sharireka janmana, means the prakrit dosh, they are responsible for formation of 7 kind of doshaj prakriti, that is psychosomatic constitution, and they are formed at the time of fertilization of during the process of fertilization. So the prakrit kaf, they come from the shukra, that is sperm, and ova, that is shonit. So the proportion of vat pitta kaf, which is formed at the time of fertilization in the zygote, that remains same all through the life, and that proportion of dosh is responsible for different kind of doshaj prakriti, and that is responsible for individual variation at the level of psyche and soma. Whereas the vakrit dosh, vakritastu garbhadi bhi nisrata yasya aharasya malaha sambhavanti. The vakrit dosh, they are derived from the ahara mal, aharasya malaha sambhavanti means produced, get produced. So when the garbha, that is the fetus, it comes out of the womb and starts taking the food then after the digestion of food, this Vakrit dosh is produced from the ahar. And this Vakrit dosh is, or Malarupi dosh, it is responsible for replenishment of Prakrit dosh, as well as it is responsible for the regulation of all the physiological functions. These Vakrit dosh, which are derived from the aharmal, they means these doshas, काल आदि वशेन स्वप्रमाण वृद्धि क्षयोगात देहम अनुग्रहणन्ति दूषयन्ति. So these Vakrit dosh, they get altered, means they may have increased functional state or decreased functional state, or they may alter in their quantity and in their quality as per the time factor. Kaladi Vashin, Kaladi means here, Kal means the time factor, that is the season, age, according to the day-night variation. So we know that Acharya Bhagavata has given the words regarding the variation in the dosh. Te vyapino apihirinabhyur adho madhyo urdhva. Although the dosha are present in the whole body and Vat Pitta Kapha reside in upper part of the Kapha and middle part Pitta, and in lower part below the Nabhi, it is the Vata dosh. But Vayo ahoratri bhuktanam te antamadhyadika kramat. But they alter in their proportion, they alter in their quantity as per the Vaya, means age factor, age. Ahoratri, aho means the daytime, ratri means the night time, in relation to the food and in relation to the age. As in the childhood there is dominance of Kapha dosh, in the middle age there is a dominance of Pitta dosh, in old age there is a dominance of Vata dosh. So these dosh, they follow circadian rhythm, they do change in relation to the time, that is the season. So, and as per the diet, type of intake of food and the type of mental and physical activity. So the Vakrit dosh, they could be considered under the category of Malarupi dosh, that is here the Malarupi Pitta, and its pramana means its quantity, it varies as per the diet, time factor, season and all these things. And if they are in their balanced state, deham anugrahananti, means they maintain the physiological homeostasis. But if they are in their vriddhi or kshay condition, so they itself gets vitiated and produce visheshan in the other dosha, that is dhatu and mal, and may produce disorder. So this is the basic difference, that the Prakrit dosh, they do not get changed all through the life, whereas Vakrit dosh, they vary as per the diet, season and activity. And they are responsible for physiological homeostasis, whereas Prakrit dosh, they are responsible for formation of psychosomatic constitution. So this is the basic difference between the Vakrit dosh, which is produced at the time of after the complete digestion of food from the Kitta part, which is replenished by the Kitta part. Now about the Ranjak Pitta. Acharya Sharangadhar has only considered the Ranjak Pitta as a mal of Rakta Dhatu. So it is also very scientific in relation to the Rakta Shrotas Mool and Rakta. So the site of Ranjak Pitta is Yakrit Plehano Pittam Tasmin Ranjako Agnireti Sangya Sarasasya Ragakrit Ukta. The site of Ranjak Pitta is the Yakrit, the liver, and Plena, the spleen. And the function is rasasya. It provides color to the Ragakrit, means here coloration. It provides color to the Rasadhatu. So what is Rakta basically? So according to Acharya Chakrapani, when we say Rakta, so it is the form in relation to the blood. So the blood has two parts, that is the plasma part and the cellular part. So plasma part could be understood as the Rasadhatu, which contains nutrients and different electrolytes and micronutrients, whereas the Rakta Dhatu could be considered as formed elements or the cellular compartment of the blood. So here the cellular compartment of the blood means the different WBCs and the RBCs. So here the mole of RBC is the yकृत and liver. So we know that during intraembryonic life to the 6 month of age of fetus, the red blood cells are formed in liver, and after the 6 month the hemopoietic function is taken over by the bone marrow. So it may be the reason that the mole of Rakta has been considered as the liver and spleen, whereas the spleen is related with the life cycle with the RBC life cycle, that when the RBC becomes old, it gets degraded into the pleha, and after that its breakdown products, that is the hemoglobin, it gets converted into two parts. It divides into two parts, that is globin and heme. Then further this heme is converted into by biliverdin by the action of heme oxygenase, whereas biliverdin it gets converted into bilirubin by the action of biliverdin reductase. Then this bilirubin gets combined with the albumin in the blood, and it becomes unconjugated bilirubin, which is not water soluble. And this unconjugated bilirubin, when reaches into the liver, it gets combined with the glucuronic acid and becomes as a bilirubin glucuronidase, which is called as conjugated bilirubin, and it is water soluble. Then it is a part of bile, and through the bile duct it comes into the intestine, and over there it gets converted into the urobilinogen by the intestinal bacteria, and its 80% is passed into the urine in the form of stercobilinogen. So in the large intestine, this stercobilinogen, it is again converted into stercobilin, which provides normal color to the urine, that is brownish yellowish color. Whereas it's 20% of the urobilinogen, again through the intrahepatic circulation, it reaches into the liver and in circulation, so which comes into general circulation, it reaches into the kidney, and from there it is excreted out through the urine in the form of urobilinogen, over there it is converted into urobilin and gives normal color to the urine, that is the little bit yellowish or pale color to the urine, straw color to the urine. So here we can see that in this bilirubin metabolism, that the RBC, it is a part of Rakta Dhatu. When it gets, if we see its whole life cycle, so it is formed into the liver and the bone marrow, and after the 120 days, when this old RBCs, when they become senescent, they are degraded into the reticular endothelial system, that includes liver, spleen, bone marrow and other lymphoid organs. So basically in the bone marrow and liver and spleen, it gets degraded, and ultimately this heme part is converted into bilirubin, and this bilirubin is excreted out into the urine and feces, and over there it provides a color to the urine and feces. So here it is again doing the Ranjan Karam, that is it is providing some color. So just by observing the normal levels of Malarupi Pitta, that is Ranjak Pitta here, we can infer about the normal functional state of Rakta Dhatu, and its mole is Yakrit and Pleha. So why its mole is Yakrit and Pleha? So in all the cases of if there is excess bilirubin in the blood, that condition is called as hyperbilirubinemia, and in all the cases of hyperbilirubinemia, ultimately this liver and pleha, they get involved, and there is hepatosplenomegaly. Or if there is excess destruction of RBCs in the pleha, that is in spleen in certain disorders, so over there is a splenomegaly. or in case of some bone marrow disorder also. So these liver and spleen, they get affected, and they are the site of examination. And just by seeing the normal levels of bilirubin in the blood, it is null, but it is retained in the body also. So if it is less than 1 milligram per gl in the blood, it's normal. And when it gets beyond that, when the bilirubin concentration in the blood, it becomes more than 1 milligram per gl, then it causes discoloration into the different part of the body. As in case of Pitta Vriddhi Lakshan, it is written that Pita Veda Mutra Netra Toka Chatur Dah Alpanidrata, means Pit means yellowish. So yellowish discoloration of Ved means feces, Mutra means urine, Netra eyes, Tvak skin, excess thirst, Daha burning sensation in the body, Alpanidrata less sleep or insomnia. So all these are the Pitta Vriddhi Lakshan which are due to vitiated Pitta dosh when it is in excess. This could be understood as the condition of hyperbilirubinemia in contemporary sciences, as we know that this excess of bilirubin in the blood, it causes yellowish discoloration of these body parts. Similarly, in case of Rakta Pradoshaj Vikar, means if there is disorder due to vitiation of Rakta dosh or Rakta Vriddhi, so in that also the characteristics are Nilika, blue mole, Kamla, that is jaundice, 𝐕𝐢𝐬𝐢, that is the freckles or different blemishes over the skin, Piplu, Pastir, Tilikalika. So all these are the different kind of pigmentations over the skin. It occur in case of Visheshit Rakta dosh, Rakta. So here the Kamla is, we know it is a clinical condition where there is hyperbilirubinemia due to various reasons. So this excess bilirubin could be considered as Malarupi Pitta or Ranjak Pitta, and its excess is in case of jaundice. So just by seeing the Malarupi Pitta, whether it is excreted out properly, as earlier in the previous lecture we have discussed that if the mal is formed in its excess, so it should be excreted out from the body, and at certain level is retained only in the blood, because it help in the mal. It has been also considered as dhatu because they help in physiological homeostasis, and recently it has been found that this bilirubin act as an antioxidant also. So this is about the Malarupi Pitta, that is Ranjak Pitta. So this bilirubin metabolism could be understood as the Malarupi Pitta or Ranjak Pitta. Next is 𝐴𝐻. 𝐴 means space. It is the mal of Mansa Dhatu. And we know in our body there are external orifices which are continuously interacting with the environment. So it is the nostrils, nose, mouth, ear, eye, and the genitalia. So all the external orifices, they have certain secretions and they have the protective function in the body. So here Acharya Chakrapani explains about Mansasya 𝐴𝐻 iti karna akshi nasa asya prajanan mala, means karna means ear, akshi eye, nasa nose, asya oral cavity, prajanan mala means the secretions over the genitalia. So all these could be considered as 𝐴𝐻, whereas 𝐴𝐻 has been although understood as ear wax or serum. So what is the reason behind formation of this ear wax? So we know that in the ear, external ear, there are ceruminous glands, there are sebaceous, there are sweat glands. So these sebaceous glands, they secrete a very sticky substance into the ear, and that is like a wax, and that makes a thin protective layer over the external ear skin. And that earwax contains long chain fatty acids, alcohols, squalene and cholesterol. So ultimately it gets deposited, and along with the external dust and dead skin, it becomes a solid mass that is called an ear wax. So basically protects the ear from the foreign agents like certain bacteria, fungi and water. So it has the protective function. Similarly, in case of eye also, there is a secretions in eye also. So the eye discharge is there. During the sleep condition, there are small depositions over the corners of the eye. So this eye discharge is nothing. It is basically a dried mucus. So there is a continuous mucus secretion and water secretion in the eye, and there are meibomian glands in the eyelids. So all these secretions, when there is no blinking, so they are not flushed off, and they get collected over the corners of the eye. This is called as 𝐻𝐼, and it has also a protective function. So all these secretions have protective function. Similarly, in nose also there is a continuously mucus secretion little bit, and that mucosal layer maintains the moisture into the nostrils. Similarly, that has the function of air conditioning. In the oral cavity also, there is watery secretion in the mouth from the saliva, and there is a bacteria, normal flora in the mouth, which make a layer over the tongue and the teeth during the sleep. Similarly, there is a secretions in the genitalia also, as in females. So there in vagina there is presence of lactobacillus, which maintains the normal pH, acidic pH, to protect that external orifice, and that secretions contain the mucus and the dead cells. So basically all these orifices have certain kind of their commensals, bacteria. There are certain mucoid secretions or certain ceruminous or waxy secretions which protect the external orifices. Now the sweat gland. Sweat is the mal of Medha Dhatu. So we have discussed about the sweat in detail in the lecture mechanism of sweating in Ayurveda. I will here give the review of that little bit. What is sweat? Basically, sweat, it is the fraction of udaka which comes out through the skin pores when there is exposure to the heat. So the Acharya Charak says here, 𝐻𝐿 anubaddham 𝐿 nishpatat swede sabdam apnoti, means with a fraction of water which comes out, nishpatat means comes out or falls through the loma pupa, that is through the root hair. So on exposure to the heat, 𝐻𝐿 anubaddham means the exposure or contact to the heat, then that udak which comes through the loma pupa is called as sweat or sweat, and its composition is mainly water. Sweda stanyam cha apyam iti. Chakrapani has given this, and the mool of Swedava Shotas is Lomakup, this Lomakup, and Medha, that is the fat, that subcutaneous fat or the fat in the body, adipose tissue in the body. So the Swedava Shotas, it has the functional regulation by the Samanvat. Swede dosh ambuvahine shotansi samadhisthita antaragnesh parshvas samano agni balprada. Swedava Shotas, Doshva Shotas, Ambuvayavadakva Shotas, all these are regulated by the Samanvat, which is present near to the Antaragni, that is near to the Jaఠragni or Pachikagni. Krishna deha charo vyano rasam vahnodita shved asrik shravarash chapi panchadha cheshtatya api. The Vyanavat, it is responsible for excretion of the sweat. It is regulated by Vyanavat. Nabhir amashya swedo lasika rudhiram rasaha drik isparshanam cha pittasya nabhir atra vishesta. This sweat is the dwelling site of pitta dosh also. So the function of sweat is it maintains a moist layer over the skin. Kledatva sneha roma dharana. It means the moisture. It maintains the moisture over the skin and the softness of the skin and unctuousness, and it helps in maintenance of these body hairs also. So in this picture here you can see there are two kind of glands, eccrine gland which directly open into the skin, and apocrine gland which open into the neck of the root hair, and the sweat which is formed in these glands, the coiled part of the gland, the sweat is formed, it passes through the duct and ultimately poured into the neck of the hair, body hair, and comes out over the skin, or eccrine gland directly pour their sweat into the over the skin. So this is about sweat, that this sweat it is the mal of Medu Dhatu. So if there is vitiation of Medu Dhatu as a clinical sign, we get impression, excessive sweating, and that sweating may have a bad body odor. So in case of obesity also, excess sweating is the characteristic, because in case of obesity also there is a vitiation of Medu Dhatu. So its clinical significance is that this, by observing the quantity of the sweating and the rate of sweating, we can have idea about the normal functional state of Medu Dhatu. And this sweat, again, it has protective function over the skin also. Next mal is 𝐾𝐿 𝐵 and 𝐁. It is the mal of Asthi Dhatu. Few important things related to these mal has been described by various scholars of Ayurveda, and it is very scientific. Like the hairs and nails are formed in 6 months of embryonic life. षष्ठे स्नायु शिरा रोम बलवर्ण नख त्वचा. So the rome, and that is the hairs, and nakh means the nails, they are formed in 6 months of intrauterine life. It is near to the contemporary science. Similarly, hair follicles remain same all through the life. It is also a very scientific thing given by Acharya Shushat. Drishtischa lomkopaschya na vardhante kadachan dhruvane etani martyanam iti Dhanvantare Mata. Here Dhanvantare Mata means the Shushat is the follower of Dhanvantare Mata. Dhruvam is nishchit or certainly, Martyanam to the death. So the lomkopaschya, the hair follicles, na vardhantim, they do not increase in number at all once they are formed all through the life. So the two things, dishti means the vision. Once the final vision has been attained, it never gets increases as the age advances. In the same manner, the rumkuk, the hair follicle, they do not increase in number. Once they are formed, they remain same all through the life. And one interesting thing is also there, given by Acharya Shushat, that hairs and nails grow even in case of dhatu chhe. Sarire chiye made api vardhate dvam appo sada swabhavam prakriti kritva nakh 𝐾𝐿 iti sthita. Means due to the inherent property of these hairs and nails, they continue growing even in case of dhatu chhe. Although we know that hairs and nails, they are the mal of Asthi Dhatu, but in case of dhatu chhe also they grow. So this is because of inherent trait, and the cause is even not known. Even in case of dead body also, when the body is not alive, so that the length of nails, it increases, and it is of very significance in case of forensic medicine. Now certain characteristics have been given in a baby regarding the nails and hairs, by observing which we can predict the long life of a child. Given by Acharya Charak in Shariristhan, 𝐾𝐞𝐿 mridu alpa snigdha subadh mula krishna kesha prashasyate. Means if the case means this hair over the scalp, they are black. Subadh mula means they are deep rooted. Hair follicles are deep rooted and strong. Hairs are unctuous. Alpa, less soft, then that baby may have long life. Similarly, about the nails also, certain characteristics have been given. Here the word karja means nails. So sthira, vritta, snigdha, tamra, tunga, kurmakara. Kurmakara means the cover of the turtle. So if this the shape of nail is like elevated like a turtle, and it is a vritta, that is almost circular, and snigdha, unctuous, and tamra, that is coperish in color. So such a baby having such a kind of nails have long life. Similarly, in Charak Vimanasthan, under the description of Sarab, it has been given that in a Twaksar person, Twaksar is also called as Rasasara, the body hairs have certain characteristics which is found only in Twaksara Purush. So Tatra Snigdha, Slaksha, Mridu, Prasanna, Sukshma, Alpa, Gambhira, Sukumara Loma, Saprabhamena, Sukumara, Saprabhamena, Cha Twaksara. So in the Twaksara Purush or Rasara Purush, the first dhatu is Ras. So the body hairs are unctuous, that is little bit oily, Slaksha, that is smooth, Mridu, soft, Prasanna, that is they are pleasant in vision, or Sukshma, that is thin, Alpa, less in number, Gambhir, that is deep-rooted. So such kind of body hairs are there in case of Twaksar Purush, and the skin is also very soft. So we know that in Sapta Dhatu, that is the rest of the Mansmit, Asti, Majja, Shukra, they are not of same quality in all the individuals. They differ from person to person. So here the word Sar means Vishuddha Taru Dhatu Uchchete, means a dhatu within the physiological range may be in a person in our state, that is in its best form, or in medium state, or in our state, that is in low functional state. So although it is normal within physiological range, but in the best form of a dhatu is called as Sar. So each dhatu has certain characteristics if the person is having the best form of that dhatu. Now, under the description of Prakriti, hair has been considered as a determining trait in assessment of Prakriti. So, in Vat Prakriti person, hairs are less dry and brownish in color. So, all the scholars of Ayurveda, they have given this due importance to the hair characteristics in assessment of Prakriti. Like Acharya Shushat, Sputitkar Charano, Alparuksha Shamashu, Nakha Kesha, Krati, Danta, Khadi cha bhavati. Sputit karacharano means crackling over the hand, kar means hand, charan means the foot. Alpa, less, ruksha, dry, shramashu, beard or hair over the face, nak, nails, and kesh, hair over the scalp. All these are less in number and they are dry. Krati means hostile, danta, Khadi cha bhavati means the person has habit of nail biting. Similarly, Charak has also given Parushakesh Ramashu Roma Nakh Dashan Vadana Padi Pata means the person has, Parush means the rough hairs, beard, body hairs and nails. Similarly, Acharya Bhatt has also given Isputit Dushar Kesakatra. Here he has added about the color also. Dusar hair we can consider it as a little bit brownish color. So sputit means brittle, or the hairs end have the hairs of having double headed. So the hairs have tendency brittleness and they are of brownish color. Similarly, in case of Pitta Prakriti, hairs are less soft but they are golden brown in color. So in the Vat Prakriti also hairs are less but they are dry. Here they are soft क्षिप्र वली पलित खालित्य दोषाः प्रायो मृद्व अल्प कपिल श्रमश्रु लोम केशाश्. Chipra means early or faster. Vali means wrinkling, palit means graying of hairs, khalit means falling of hairs. So in Pitta Prakriti individuals, inherently there is tendency of early wrinkling, graying, premature graying of hairs and falling of hairs. And the quality of this Ramashru, loam and case is mridu, that is soft, alp, less in numbers, kapil. Kapil word is the kapil means here is a monkey, so color is almost like a hair color of monkey, that is golden brown color. Shamashu, all have these kind of characteristics. Similarly, and Shashrat has also given Tamra Nakh Nayan Dalu Jiva Oshtapani Padatalo Durbhago Vali Palita Khalitya Jishtu, means the nails are of copperish color. Vali, early wrinkling, Palit, again graying of hairs, and Khalitya means falling of hairs. Pinga Kesho Alparoma. Here Bhagvat has also given the same thing. Pingakesh means here Pingal word means that again brownish reddish color or golden brown color we can say. Kesh color and Alparoma. Body hairs are less in numbers. Whereas in case of Kapha Prakriti, hairs are curly, dense, thick, dark and soft. Sthir, Kutil means hair curly, Ali means the bhaura, a kind of insect, and the hair color is black as of this insect called Ali or bhaura. And the ghan, they are thick, hairs are thick, and neel, again it is dark in color. So this is the characteristics of hairs in different Prakriti individuals, and the difference in the hair color, it refers to the difference in their state of Asthi Dhatu also. Now what are the causes of hair loss and premature graying? So if we see the characteristics of Rasa Pradosaj Vikar or the Asti Pradosaj Vikar, means in case of the disorders which are produced due to vitiation of Rasa Dhatu and vitiation of Asti Dhatu. So in both the case we get the characteristics related to the hairs over different part of the body. So Valaya Palitani Cha Rasa Pradosaja Roga. Valaya means the wrinkling, Palitan means premature graying. So in case of vitiated ras dose, so if we know the ras dose is basically the ras is the dhatu which provide nourishment to all the tissues, including Asti also. So if there is any kind of deficiency in the ras dhatu, that may be related to the early premature graying of hairs and wrinkling of the skin. In Asti Pradoshaj Vikar also it is written Adya Asti Danto Dant Asti Bheda Shulam Vivaranta. Adya Asti means the teeth over the teeth. Dant Asti Bheda, pain in bone, or there is tendency of fracture and pain in the bone. Vivarnata, discoloration. So in the calcium and the vitamin D, they are related with the Asti Dhatu, that is bone. So if there is calcium deficiency, so there is discoloration or hypopigmented patches over the face also. And Kesha, Loma, Nakha, Shramashu, Dosha. Here the changes will be found in case of Kesh, hair, that is the hairs over the scalp, Loma, body hairs, Nakh, nails, Samashu, that is beard. So in case of the vitamin D deficiency and calcium deficiency, we get the hair fall as a sign. Because if there is Asthi Chaya, then it will be associated with the loss of its smell also. So that's why there is more and more complaint of hair fall in case of vitamin D deficiency or in case of calcium deficiency. And these two are related with the premature graying also. So the deficiency of iron, zinc, copper, calcium, vitamin B12, vitamin D, low HDL, low thyroid hormones influence the melanogenesis, and they lead to the premature graying and hair loss. So all these things have been associated with the hair loss and premature graying. Similarly, in case of protein energy malnutrition and disease causing chronic protein loss are also associated with reversible hypopigmentation of hairs. So in this picture here you can see the hair color of this child. It is brownish at the end. So when the protein is replenished or supplemented, then the hair color become normal again. So this the nutrient of this protein, energy malnutrition and the deficiency of all these things, it could be understood as a deficient Rasa Dhatu, or it could be understood as a deficient Asthi Dhatu, because the nourishment of Asthi Dhatu, it depends on the Rasa Dhatu. So if the Rasa Dhatu is deficient, so ultimately it will affect the nourishment of all the Dhatu. So we can get the changes in Dhatumal also. So this is very scientific description related to this Asthimal. Now some other interesting thing related to the hair loss and graying has been given by different scholars of Ayurveda, as Acharya Shushruta has told that above the age of 70 years, wrinkling of his skin and graying and falling off hairs occurs normally. Above the age of 70 years. So this is the verse. Saptate urdhva means above the 70 years. Chiyamana means there is decrease in the dhatu, that is tissues, indriya, the functional state of indriya, bala, that is immunity as well as physical strength, utsaha, virya, that is sukra, that is semen, utsaha, that is enthusiasm, along with the complaint of a wrinkling of the skin, palit and khalitya. Certain emotional conditions also cause premature graying of hairs. Again, this is very scientific description. Krodha soka sham krita sarira ushma sirogata pittam cha 𝐾𝐿 pachati palitam tena jayate. So these emotional disturbances cause visheshan of pitta dosh, an imbalance in body heat that reaches into the scalp, and over there it causes premature graying of hairs. Similarly, excess intake of lavad ras, it causes vali, palit and khalitya. Even in an individual, and if the excess intake of lavad ras is by a pregnant woman, then it may cause sikra, vali, palit, khalitya in offspring also. As in Ayurveda, it is advised that a person should take Shadaras Yukta Ahar, that is Madhur Amla Vadakatu Tikta Kashai, in a balanced quantity. And if someone relies only in a one ras, or like in case of excess intake of lavad ras, so that may be associated with this hair loss and premature graying and early wrinkling of the skin. And the cause of hair loss and graying is genetic also. So this is again a very scientific description under the description of Pitta Prakriti, that Chipra, Vali, Palit, Khalitya dosha. In the Pitta Prakriti person, they are having inherently, because of dominance of Pitta dosha in their constitution, early wrinkling of the skin, premature graying and falling off hairs than other two Prakriti. And the mal of Asthi is again nak, nails. So Acharya Charak has enumerated these nails 20 in numbers and counted under the category of Asthi, although we know it is not a bone, but at that time he has counted it under the Asthi. And certain characteristics of nail has been described, as I earlier discussed, that if the nail is having a little bit vritta, circular, unctuous, and it is of copperish color and elevated like a cover of turtle, then it may be associated with the long life of a baby. Similarly, according to the Prakriti also, as just now earlier I told, that in a Vat person nails are dry, and in Pitta Prakriti person it is of Tamravarna, that is copperish color, and in case of Kapha Prakriti it is white and shiny. So this is normal in different individual persons. The color of nail and its size and shape, it differs from person to person. So also it is related with the somehow psychosomatic constitution, and it is also considered as a trait in determination of Prakriti. In case of different deficiencies of Asti Dhatu, like in case of calcium deficiency, we get these kind of white patches into the nails. Similarly, in various other disorders also, we get changes into the nails. Like in case of clubbing of the fingers, like the fingers end becomes like a drumstick. In case of liver disorders, that is the cirrhosis, or COPD, that is chronic obstructive pulmonary disorders. In case of iron deficiency anemia, that condition is called as 𝐷𝐿𝐼𝐴, and this nail become a spoon shape like this, and there are ridges, and it becomes very brittle also. So these nails, they may be just by observing the status of nails, we can infer about its dhatu and various other tissues, functional state of other tissues also. As we know, the tissues, they are interdependent on each other for their metabolism. Similarly, this is the picture showing different kind of changes in nails in various disorders. So here I will tell you some common conditions, like the 15 number is here, the white nails in case of anemia. The nail become a paler white. The healthy nail color is of copperish color or pinky color, but when there is deficiency of hemoglobin in the blood, so the color becomes like this. Similarly, in case of the Vat Prakriti person, the person has habit of nail biting. So in that case, nail becomes this nail ridges go inside, and because of continuous nail biting, and nail becomes shorter like this at 9 number. Similarly, in case of fungal infection, the 5th number picture, it is showing the fungal infection into the nails. And 18 number picture, it is showing the hypothyroidism cases. The nail become very transparent and it becomes brittle. So there are different kind of changes in the nails also when there is dearrangement in the different dhatu where shrutis. So just by observing this mal, although it is a dhatumal, but just by observing the nail, we can infer about the functional state of different dhatu and its mole. Now the last one is the Shukramal, that is Yuvan Petika. Although none of the Ayurvedic scholar except the Sharangadhar has described about the mal of Shukra Dhatu, all have considered that when the Shukra Agni act over the Shukra Dhatu, there is no generation of mal. But it is a very scientific description by the Acharya Sharangadhar. So Yuvan Pedika, that is acne. It is related with the Pitta Prakriti persons, and it is inherently in a Pitta Prakriti person, there is inherently dominance of Pitta Guna Dosh, Pitta Dosha Guna in the body, and because of that, there is Prabhuta Viplu Vyanga Tilipedika. The Pitta Prakriti persons have tendency in their adolescence formation of acne over the face, or different kind of blemishes or discolorations over the skin, and excess of moles. Tilipedika, tail made the blackish or reddish color pigmentations over the skin, and pedika means here the Yuvan Pedika or acne. So if we see the causes of acne, so these two important things we get even in contemporary science, that 80% cases of acne there is genetic predisposition. So this refers to the genetic predisposition of Pitta Prakriti individuals because of inherently dominance of Pitta Dosh, and it is the mal of Shukra Dhatu. So we could understood is there is association of androgenic hormone activity and acne. It is proved during puberty the androgenic hormone activity as it goes up, it causes increased activity of sebaceous gland in the skin, especially the face, on causes increased production of sebum. And if there is the clogging of the pore of the gland, or if there is some kind of due to some unhygienic condition, there is some kind of bacterial infection, so that causes formation of a smaller pustules over the sebaceous gland root or hair follicle root. So this androgenic hormone, that is the sex hormone, that is could be understood as its association with the Shukra Dhatu, and that's why Acharya Sharangadhar has considered it as a mal of Shukra. Although there are so many regions of the acne, like in case of females, in polycystic ovarian disease syndrome, there is formation of acne, or in case of hormone replacement therapies, or in case of some drugs which have androgenic effects, there is hirsutism and formation of acne. So in case of androgenic hormone activity, there is association with the Shukra Dhatu. That's why it is considered as a mal of Shukra. So I think this is all about the Dhatumal, how they are formed, what are their physiological and clinical significance, and why it is important to know about the Dhatumal. So Dhatumal are basically very important in clinical examination. Just by observing the Dhatumal, like the level of bilirubin in the blood, the level of malarupi pitta and the malarupi kapha, the status of hairs, nails, and the discharges into the external orifices, all these expresses about the normal functional state of the respective dhatu. Since dhatu are interdependent on each other for their metabolism, so it may be associated with another dhatu also. Like changes in the nail, it may be associated with the rasa dhatu also, it may be associated with the asti dhatu also. So that's why the Dhatumal has very great role in clinical significance as well as in the physiological homeostasis. Thank you.